The comprehensive rural health project Jamkhed has been a major source of inspiration to the health initiative in Andhra Pradesh being undertaken by the Society for Elimination of Rural Poverty. We are indeed very grateful to Dr. Arole for the kind of interest he has taken in the program in Andhra Pradesh. I would say the success of the program in Andhra Pradesh owes a very great deal to the inspiration provided by Dr. Arole. He has visited the project several times and all our health functionaries have been to Jamkhed for training. When I see them coming back and participating in the debriefing session, in addition to training, there is something magical that happens when they go to Jamkhed. It is a lifelong memory with them, which guides them, which acts as a conscience keeper, which is inbuilt into them once they visit Jamkhed. Thanks to this support, we have been able to operationalize the ideas that he has implemented so well in CRHP Jamkhed. What struck me most was the insistence on the training of the health activists. According to Dr. Arole, the regular training of the health activist is the key to long-term sustainability of this intervention. We have internalized very well how each member in the society, how each family internalizes the health messages. So, the health activist, the major job, major task for her is to build this knowledge in each member that they themselves can take care of the health and they have all the facilities, local resources, and the health activist creates that confidence in each family that they can take care of the health. So, we see that as the next goal for us, that each household should be confident of taking care of its own health. So, learning from his model of social workers at the base hospital, we have put in place in select mandals and districts case managers who provide this escort service to the poor member when she or he enters the hospital. These case managers are provided at government hospitals and also in private hospitals to ensure that the poor members are not deprived of their entitlements and nobody takes undue advantage of them. And more important, there is a caring person who is available in the hospital and accountable to the community based organizations. The other intervention which is proving to be a very important intervention in Andhra Pradesh is the concept of nutrition centers for pregnant women, lactating mothers and children. We have drawn inspiration for this from the community kitchens which had been set up in Jamkhed. This success of the nutrition centers can redress the imbalance at policy level, both at the state and at the national level. The manner in which we are scaling up this program in Andhra Pradesh is through the concept of community best practitioners or community resource persons. So, those women who have, whether it is the health risk fund, whether it is the nutrition center, whether as a case manager. So, the women who have benefited from health interventions and have the aptitude to take this work to other districts are selected as community resource persons, and it is through these community resource persons the entire health intervention of the Society for Elimination of Rural Poverty is being scaled up in Andhra Pradesh. Even here we have drawn inspiration from the work done by Dr. Arole and his team. We are indeed hopeful that with his continued support, we should be able to scale up our program to all the villages in the state of Andhra Pradesh. And In my view, that would be the appropriate Guru Dakshina for him, that we've been able to implement his ideas sincerely with his guidance in the entire state.
Realizing a dream. The first flowering of community-based primary healthcare opportunity through a grassroots movement in Andhra Pradesh is distinctive from what Andhra Pradesh is today. It's a health initiative weaved around the leadership of women to take home the messages for improving the overall health standards of poor and the poorest of poor in the villages. This opportunity has placed women center stage to manage health and nutrition related issues, be it PHCs, organizing NH days, running nutrition centers, maintaining community kitchen gardens, taking care of food security measures, running dairy farms, managing self-funded health insurance and health risk fund, taking care of water and sanitation measures, and livelihoods. In short, women have ushered in complete health care into the villages, which is not only essential and socially acceptable, but also universally accessible, participatory, and affordable. They were not alone to begin with, but aided by the Society for Elimination of Rural Poverty and the training they received at Jamkhed, their proportion rose rapidly. As a result, today there are over 6 lakh SHGs in Andhra Pradesh with a burgeoning membership of over 90 lakhs women. This opportunity has kick-started a movement, making the women move from traditional healthcare myths to honing technically sound skills in primary health care. Today, they are undergoing training at institutes, colleges, and workshops. They now have the ability, skills, and the opportunities to develop health agenda into an ever more important instrument in the struggle against poverty. Indeed, they are slowly but surely changing the health scenario in their communities. The results are simply overwhelming. So far, 200 nutrition-cum-daycare centers have been established. 605 children were born in 200 community-managed nutrition-cum-daycare centers in a period of 1 year. All the children born with 2.5 kgs birth weight and more. 100% women had ANC and gained weight between 7 to 12 kilos during pregnancy. 57% children born with more than 3 kgs birth weight. 94% women had normal deliveries. 6% had cesarean sections. Neonatal care being practiced are colostrum feeding, wrapping the baby, no pre-lacteal fluids are given to the newborn except mother's milk, delay in bathing during the first 7 days after birth. To a large extent, the women owe their success to Dr. Arole and to his comprehensive rural health project Jamkhed, popularly known as CRHP, where he trained each one of them to develop communities through a grassroots movement and in turn changed the contours of their lives. The low-cost program, jointly funded by the SCRP and the SHGs, is now being replicated in over 2,000 villages, covering 4 lakh women in the state. The wonderful work that Dr. Arole and CRHP are doing has spread to 300 villages in Maharashtra. CRHP has been a source of ideas and models for many institutions in the field of primary healthcare that have sprung up around the world. Replicas of the Jamkhed model operate in more than 100 countries worldwide. Extending primary health care to poor people through simple methods and interventions had appeared to be an impossible idea. From modest beginnings 3 decades ago, when they returned from the United States, Dr. Raj Arole and his wife, Dr. Mabel Arole, established CRHP as a tiny homegrown project run with the help of several local women living in and around Jamkhed. It was fueled by the belief that health is a fundamental human right. Their objective was to empower poor people, families and communities at the grassroots level through integrated efforts in comprehensive community-based primary health care and development. And it worked. The Jamkhed model functions at 3 levels: village, mobile health team and base hospital and training center. At CRHP, emphasis has always been placed on women's empowerment and raising the level of self-esteem, especially among girls. Family planning and the promotion of adequate birth spacing still remain among the priority areas. The village health workers work closely with the women whose task is to convey to the SHGs all relevant health and other knowledge gained at the CRHP training center in order to reach out to the community as a whole. As health took center stage in Andhra Pradesh, the SCRP entered into a partnership with CRHP in 2004 to train the women SHG members on the Jamkhed model. As a result, the women from the villages were first selected by their community to undergo training in health and development at CRHP Jamkhed under the guidance of Dr. Arole. The approach was value-based with emphasis on personal growth and leadership. Once trained, they came to be known as Health Community Resource Persons, that is, Health CRPs. Few were semi-literate, many were illiterate, but they had a genuine interest in serving their community. Today, they deliver primary health services and education in prevention and treatment of common and minor illnesses. They organize groups in the community which are motivated to improve their situation, especially the poor, the marginalized and the women. The provision of curative services has been found to be an essential component in establishing the sustainability of all primary health-related activities and programs. Ensuring an adequate referral network and providing easily accessible quality care at an affordable cost has also done much to enhance the credibility of health activists and improve the health of these rural communities. These women have become agents of transformation in their villages. The fact that 80% of the health problems can be taken care of at the village level makes the work of health activists an integral part of the project and its success. The Jamkhed model has meant a social revolution in the development sector. Good health and nutrition, clean drinking water and sanitation has proved to be a liberating force in societies where women in particular have to struggle against repressive social and economic conditions. Jamkhed model, as it has come to be known, was acknowledged by the World Health Organization and the UNICEF as a model for sustainable primary healthcare and development. The training center receives both national and international participants representing health and development workers from government and non-government sector, grassroots workers, doctors, nurses, administrators and students. They receive training in the principles and practices of community-based health and development, leadership skills and personal development. Dr. Raj Arole and his wife Dr. Mabel Arole were awarded the Magase Award in 1979 in recognition of their contributions to the field of community-based primary health care. Government of India awarded them Padma Bhushan for their exemplary work in social service in 1990. More awards followed. From treating patients in the villages around Jamkhed in the 70s to designing self-sustaining health programs for the rural poor, Dr. Arole has advanced to the forefront of a burgeoning world movement towards eradicating poverty through sustainable approach of building the capacity of communities to address their own health through primary health care. The emphasis on women may have been the most important factor in the success of his work. Health professionals, there may be many, but these village women as health activists are providing sustainable primary health care in their communities. As more and more numbers of women get trained under the Jamkhed model, Health for All could soon be a reality.